I have fibroids and I love to talk about it. Lots of young women have fibroids and they're struggling with. My mom had fibroids. As long as a woman has started seeing her period, she is, vulnerable. She's at risk of having fibroids. So if you are a woman and you have a family history of fibroids, probably your mom had fibroid or you have a sister or an aunt that had fibroid, you are at high risk of having fibroid. You should not eat rice from morning, afternoon, night. There are people that love rice that much. If you are at high risk of having fibroids or you already have fibroids, being a fibroid coach has really exposed me to a lot of other women who have fibroids, who are managing it silently, who are depressed, who cannot conceive, who cannot manage the symptoms, who are pregnant and have lost their fetuses because of fibroids.
She's a nurse and she's also an author of two books on how to manage fibroid during pregnancy, talking about the pain management and also the dietary management. My chest
Your chest, right?
My chest don't dey beat. So are there treatment modalities for fibroid?
Yeah, there are. There are treatment modalities and
it's another episode of the Intimate Matters podcast, your go-to podcast as it pertains to issues of sexual and reproductive health. And today we're here again to discuss a very awesome topic, right? While I still had in the pipeline to discuss this topic, something popped up, I think, on the social media space. A very popular man of God came and said that this issue that we want to discuss about, that this very issue is caused by, he said that it is the spiritual babies that are given to women by their spiritual husbands. I quote what he said. So today we want to discuss about this issue, and I'm very grateful that the person that will be discussing this issue is a spiritual woman, but we'll be looking at it from the medical point of view. We know that during periods or in between periods, a whole lot of women come down with heavy bleeding, with bloating, and with the not enough knowledge as it pertains to period, as the case may be, people are bound to normalize everything. But oftentimes, these things are not normal. Sometimes this pain, this excessive bleeding could be fibroid. And on today's episode, we want to discuss fibroid. And I'm here with an amazing healthcare personnel. She's a nurse and she's also an author of two books on how to manage fibroid during pregnancy, talking about the pain management and also the dietary management. I'm joined in the studio today with Nurse Imaite Oliver. Thank you for joining us.
Thank you so much, Nurse Akpan. It's a pleasure being here. If I listened very well, you said you have someone that is spiritual. Your guest today is spiritual. Well, I can't really affirm to that too.
Okay, so let's start with that. What is fibroid? I don't want to ask you what is fibroid.
Okay. So fibroids are growths, and these growths are non-cancerous. Medically, we call non-cancerous growths benign. They're not cancerous. That means they can't form cancer or they can't turn into cancers, okay? So they are non-cancerous growths or tumors or benign tumors that grows in or on the uterine walls of a woman. And mostly the people or the category of women that have this are those in their reproductive age. And if I want to simplify that, I would say that women that have started seeing their periods are at risk or are the ones that can have fibroids. So as long as a woman has started seeing her period, she is, vulnerable. She's at risk of having fibroids. So fibroids are benign growths that form on or in the uterine walls, and they comprise of muscles and tissues.
Okay, so thank you for because I think we also I believe that then it most likely is a misconception. We're not trying to downplay whatever people believe spiritually as a belief system. People are allowed to believe as much as whatever they want to believe. But then you talked about the fact that women of reproductive health, of reproductive age, are actually at a higher risk of it. So now let's boil down what actually is like the causes of fibroid. So why is it that it's women of reproductive age that are more at risk?
Okay, so scientifically, we do not really have a specific cause of fibroids. And when we were in school, there's this word they usually use, idiopathic. Most of the disease conditions they say is idiopathic, or they have idiopathic causes. And in a layman term, that is unknown. So for fibroids, we can't really point at anything that really causes it. However, there are some factors that can influence it or does influence the growth of fibroids. And one of them, which is the most common, is the hormonal factor,
Okay.
and that is the female reproductive hormones, and that is estrogen and progesterone. So high levels of these two hormones are what influences the growth of fibroids, and that is why most times women in their reproductive age, that is women who have started menstruating, have fibroids, because at this stage or at this age in their lives, the estrogen and progesterone are at high levels. That is also a reason why most women have fibroids when they are pregnant. That is because during pregnancy, there is always a surge in these two hormones, estrogen and progesterone. So these are some of the causes. However, we also have risk factors, because we can't just pinpoint one thing. The only thing that we can, or scientifically we've been able to say this is what causes this, is the hormonal imbalances or the hormonal factor. However, there are other factors that could lead, or there are other risk factors that could influence the growth of fibroids, and this includes genetics, also family history, obesity being on the high level. However, all of these things still boils down to the hormonal influence. So if you are a woman and you have a family history of fibroids, probably your mom had fibroid, or you have a sister or an aunt that had fibroid, you are at high risk of having fibroids. That is because this runs in the blood. I should say that so you understand. It runs in the blood. It's in your lineage. And also we have genetic factors. We also have obesity. It has been, scientifically proven that fats or accumulation of fats exacerbates, the release of estrogen and progesterone. That is why most persons who are high or have, let me say, their BMI is high, over 30, they are obese, tend to develop fibroids. So we have a few of other risk factors, your lifestyle, alcohol, smoking, poor diets, not exercising. All of these are risk factors that could, expose you to having fibroids.
Okay, so something that always drives my interest is the fact that you talked about family history, and somewhere somehow it usually starts with one person. Because I know that there's always going to be a family history that people will question, why did it start with you? My grandmother did not have it. So the first part of this thing is that, is it possible that someone could actually have fibroid, live a life, and maybe die and leave this world, and doesn't actually know that she had it?
Very true. There are some fibroids that are asymptomatic. They don't present with any sign or any symptom at all. So a woman can comfortably live with fibroids all through her life. And also you should know that fibroids degenerates and shrinks as women approach menopause. So a woman could, especially women of those days, they could have been experiencing some of the signs or some of the symptoms like heavy bleeding, and they would not take their mind there. They're not worried to go and have a health check. So, and obviously, it's not all the fibroids that causes problems with fertility. So, if they're able to conceive and bear children without any problem, they're not worried about it. And it gets to a point that as they approach menopause, these fibroids begin to shrink, doesn't give them any problem. So they could live as long as 90, or as long as God keeps them alive, and they do not have a trace. They don't know. Not that they haven't seen the symptoms, but it's not life threatening. They're not worried about it.
Okay, okay.
So that makes it a little bit dicey, because if you come from such a family that, probably your mom had fibroids and she didn't pay attention to the signs, and she lived her life okay, fair enough, without surgery, without complications. And you as well do not, you don't take, I don't know how to really put it, but the fact is your
Yours
situation
becomes
might,
manifest.
yes,
Okay.
yours might not be as good as that. Why? Because now we have a lot of triggers, we have a lot of
Okay, that
things.
was just what I was about to come to. Why
Yes,
is it that a generation could live and go
yes,
without actually, they could have it, but it didn't manifest?
yes.
Why is it
Sing
manifesting in this
now.
generation?
Perfect question. That's primarily because of our diets.
Okay.
Yes, we have a lot of estrogen diets, or I should say, yeah, estrogen diets. Let's start with our meat, the meat we consume. Let's say, let me just use chicken. Most of the chickens that we eat are red, and the medications they are given, in all honesty, have a lot of estrogens, and that's what makes this chicken swell up,
True. Okay.
become big, full, and you see it and you like it. So we have a lot of foods right now that are estrogen based, and they're not healthy at all. So women who already have high levels of natural hormone, estrogen and progesterone, consuming this makes it triples it, or even makes it, higher than their body can take, and this influences the fibroids. This makes their symptoms worse than that of their mothers, or worse than that of their relatives. So that's just what is making it rampant these days. You see someone in her early 20s have fibroids and has had a surgery done already. So basically that is the reason.
Like times like this, when I hear things like this, I'm very grateful for my grandma, who I grew up to meet, who insisted on not eating. No, quite specifically, she insisted on not eating a couple of things. My grandma, till she died about 10 years, or 10 years plus ago, she doesn't eat. She doesn't use seasoning cubes. She raised her own chicken. This one that
Yeah.
forages around on the ground and runs around. She tells you that whatever you bring, she doesn't, this is the one. She, if you want to, so like now, over here at the end of the year, there's a whole lot of gifting. So my grandma tells you, bring my chicken from months
But
before.
yeah,
Yeah,
so
bring
she
my
can
chicken
rear
so
them
that she can
herself.
see her chicken
Grow.
grow beforehand.
Yeah.
And so it goes to show that it's unfortunate that I think it was one of my lecturers that said that with no more eat diet, that they've removed the tea in our diet and we eat to die,
Yeah.
because of the alterations that we've had in the things that we're
Consume.
consuming. So you had mentioned the symptoms, talking about the fact that some people may have the symptoms, some people are asymptomatic, some people have the symptoms, but maybe don't pay attention to it, maybe because it doesn't really manifest so much. So what are the symptoms that people should look out for that
Okay.
could be pointers to the fact that maybe this is fibroid?
Okay, so one of the most common symptoms is heavy bleeding during periods. These bleedings, normally you should not use more than 2 pads or 3 pads in a day. You should not change your pad earlier than, let's say, after 4 hours. But there are some people that during their periods, it just flows constantly, and they have to keep on changing so they can use up to 2 pads, like 2 packets of pads during their periods. So one of the symptoms you should not ignore, you shouldn't sleep on, is heavy bleeding. Please, if you're experiencing heavy bleeding during your period that comes with unbearable pain, I know that period is supposed to come with cramps, but not the one that is really chronic, one that is very unbearable. So if you have unbearable pains and you have excessive bleeding during your periods, you also bleed in between periods. That means that you are not seeing your period, yet you are bleeding. It's not your menses time. That is not the 5 days or the 6 days normal that you should have but you are bleeding. That is bleeding in between your cycle. That is not normal as well. If you have bloating, especially during periods, that's also another symptom of fibroids. However, they share symptoms with other gynecological conditions in women, but this is why you need to see a doctor when you experience some of these symptoms. You also have abdominal distension, and that is when the fibroid is actually big. There are some persons that have fibroids the whole of their age, and you can't even see it through, like it's not visible.
Okay.
You can't see their stomach being bulging or being big. But there are others that have fibroids and they have abdominal distension, also have frequent urination, and that is also influenced by the size and the position of the fibroids. So if you have fibroids like pedunculated fibroids or subserosal fibroids, this grows quite big, and it could extend into your pelvic areas where you have your bladder, and then if it's presses on the bladder, it could cause you to pee frequently. There's also dyspareunia, that is painful coitus, painful sex. That is also influenced by the size of the fibroids and the location of the fibroids. There's also cramps. I've mentioned that. So those are the few symptoms of fibroids. Also, note this: back pain is very common as well. So these are symptoms that if you experience them, you should see a doctor, you should see a gynecologist, have some investigations, have some, tests done for confirmation and for proper diagnosis.
All right. So when we mention things like this, it brings back to something that we have reiterated time over time again here on the Intimate Matters podcast about how much it's important for ladies to actually track their menstrual cycle. In fact, is I personally, for me, I feel it's actually like one of the vital signs of being a woman, because
Yeah.
if there are alteration, if there are changes, if there are abnormalities developing somewhere, somehow, not always, but most times, it's going to show in your period. Either it's
Yeah.
going to be too much, too little, coming too frequently, maybe in terms of volume, in terms of frequency of reoccurring. And like we usually say here, please, it's essential, track your period. Most of these things will show up in your period, and you can only know the abnormal from the normal
Normal, yeah.
only when you've been able to track your period. So if you're just joining us, we're talking fibroid today. Now, this fibroid is the medical fibroid, not the one that is the spiritual children. And we have the amazing Nasimite Oliver here talking with us. Do well to follow us on all our social media platform, on YouTube, on TikTok, on Instagram, and Facebook. And do well to, when you check our YouTube description, you see the link to our WhatsApp channel. Do well to interact with us, and we'll be glad to hear from you. If you have your questions, just put it in the comment section. So I think you brushed a little bit on something, because I feel that that could also be a reason why one fibroid will manifest and the other fibroid does not manifest. What are the different types of fibroids, or do we have like different types, or it's just like one size fit into all?
Not at all. So we have a way that fibroids are categorized. We have them according to their locations. That is that's the standard categorization of fibroids depending on the location. We also have different sizes of fibroids. It could be as small as a seed, a mustard seed, or as big as a watermelon or a jackfruit, if you know that. It could also be one, it could be two, it could be three, four, five, six, seven, 10 in one woman. So fibroids are categorized according to location. We have the one we call intramural fibroids. We have submucosal fibroids. We have subserosal fibroids. We have pedunculated fibroids. So the intramural is like the most common type of fibroid, and most times it grows in the uterine cavity. That's the uterine wall. That's the intramural fibroids. You also have the submucosal fibroids. They grow under the lining of the uterus. And then we have the subserosal fibroids. They grow under the outer surface of the uterine cavity. And sometimes they actually go extend into the pelvic area, and that's why most times subserosal fibroids affect childbearing, because it impedes the head of the child from descending. And it also causes abdominal distension and also frequency in urinating because it affects the pelvic organs like the bladder. And then we have pedunculated fibroids. This type of fibroids um, grow still in the uterine cavity, but they have a stalk or a stem. So they call it mushroom-like fibroids. So these are the types of fibroids that they are, categorized according to the location. So you could have fibroids as small as 1 millimeter to as big as 20 centimeter or 8 inches. That's as big as a watermelon. Basically, this is what we can call types or category,
Of
yes,
fibroids.
classification of
Of fibroids.
fibroids,
All right.
yes.
So just before we get to other things, especially as it pertains to how it affects fertility, I know you've written two amazing books looking at how to manage it, the pain aspect of it and also the dietary aspect of it. So why fibroid? There could have been so many different things you would have written about. Why did it have to be fibroid?
I hope you can contend this. I hope you can contend this question. Okay, so I think you didn't mention that I'm a fibroid coach as well. And fibroid is something that is really personal.
Okay.
And that is because I'm a fibroid warrior. I have fibroids and I love to talk about it. And I usually say that most times I make a joke out of it. I'm the only person that has fibroids, right? But the truth is, I realized that when I started talking about fibroids, when I started sharing my story about fibroids and how I scaled through my pregnancy with fibroid, a lot of women identified with me, and that is, I should say, that means so much to me because I know that there are a lot of controversies, there are a lot of myths that is around fibroid. There are a lot of misconception that people have about fibroids and women that have fibroids. Just like you said, it's not the first time I've heard that. It's a spiritual baby given to women by their spiritual husband. That sounds really awkward, but we can't force people to be exposed. Okay, I don't believe that if someone is spiritual, the person should not be exposed, medically exposed. Okay, so fibroid is really personal, and that is, like I said, I'm a fibroid warrior, and I realized that a lot of young women have fibroids and they're struggling with it. When I started doing fibroid coaching, I realized that fibroid is depressing, really depressing more than people see it. And that is because some women do not even have a clue. They don't understand what it means to have fibroids, or they don't understand how to go about approaching somebody that's okay, they have fibroids. What do they do about it? And all of that. And I know that this is a podcast and is going to be aired, but I want to be very honest as well. My mom had fibroids. My mother had fibroids, and she usually tells me, even recently she did that. She told me that she had fibroids after she had me. I'm her seventh child. So she has six other children before me and didn't have fibroids. And like I said earlier, that one of the things that influences the growth of fibroids is pregnancy. So you can see that the more the numbers of pregnancies she had, the more, or that brought an increase to the level of her estrogen, and she may not have realized that those fibroids were there even when she had other kids, but it became a problem after she had me. And I feel that is why she usually tells me that she had fibroids. So she had these fibroids for years, and there was no proper management. They didn't even tell her that she had fibroids, to be very honest, in the hospital. They just told her we'll manage it, and it became a problem until she had a surgery. she had a total hysterectomy, and that was the best for her because
She had already done with
she
having
was
children.
done with that. So fibroid is a very personal. I've coached over 100 women that have fibroids. Some of them had fibroids in their early 20s, have had surgeries done, and they have complications from these surgeries like infertility because there was no proper management. And like I used to tell people, having a surgery done is more like okay, the type of surgery, actually there are types of surgeries that you do, and it's more like cutting, weeding. You're not uprooting,
Okay, you're
you just,
just
yes. So
clearing and to
yes,
regrow.
so most women who have these fibroids, actually, when they get to the times that they are trying to conceive, they realize that they still have fibroids. The fibroids are even bigger, more in numbers than what they had before they had the surgery. So fibroid is a really personal thing for me. And my experience with fibroids during pregnancy, I told myself, no, I have to share this experience. I have to let people know the things you should do, how to manage the pains, because it was it was a roller coaster of emotions for me. It was really depressing. Managing fibroids with pregnancy for some women can be very, very challenging. And I realized that I'm not the only person going through this. So being a fibroid coach has really exposed me to a lot of other women who have fibroids, who are managing it silently, who are depressed, who cannot conceive, who cannot manage the symptoms, who are pregnant and have lost their, fetuses because of fibroids and poor management. So these are the drives, these are the motivations I had to write up to write my book on pain management, because there are things that you can actually do as a woman who is, navigating fibroids with pregnancy, and also diet modification. There are things that women ought to do to, prevent or to reduce their symptoms or the complications of fibroids.
All right. So because when you talked about this, and now it's my mom also has 7 children. So now I'm already trying to
No worries.
I'm already trying to put my head around it, again, again and again. I know that I know a couple of my female siblings that are actually at risk of having fibroid, by the way. And like you said, there's been a whole lot of alterations, negative alterations,
Media.
when it comes to our diet and the kind of lifestyle we're living, the sedentary lifestyle we are living, is not helping people. People used to move around. Let me not even use any other thing. People used to move around a lot, but now we really move around.
Yeah.
Your mom will be like, "I'm going to the next village to visit my friend." Now, what will happen? What happens to FaceTiming? So they'll FaceTime and they'll do a group call. And I think thank you so much for the things you do, because I think top of whatever it is that people suffer a lot when it comes to issues like this, at the top of everything stands ignorance,
Yeah.
where most people don't even know what is wrong with them,
Yeah.
or if something is even
Even
wrong
wrong
with
with
them.
them. Yeah.
Because you see people, you talked about the issues with the period. So you see people, I'm like, I used 2 pack of pad, 3 packs of pad, pay flow. They say it as a thing of pride. In fact, you go on social media, you see people come out to boast about it. So maybe, for example, when they're doing like jokes and they're talking about how expensive menstrual products are and taking care of maybe your woman, they'll be like, my own is always very expensive. I use like 3 packs monthly. And like, and they don't even seem to feel that something
Thing
is
is,
wrong with them. They just feel like they've normalized it.
yeah.
So when did it? Since when I was 20, it always happened that way. It wasn't like that before, but it just started happening that way, and
Yeah.
people get them to know this. So fibroid has treatment, right? So what are like the treatment modalities? Because if it doesn't have, if it doesn't have treatment, my chest
Your
on
chest, right?
my chest on the beat. So are there treatment modalities for fibroid?
Yeah, there are. There are treatment modalities, and this depends on a few factors like the size of the fibroids, the location of the fibroids, and also it depends on the individual. Is this person ready to take up a particular treatment? Is the person ready? Is the person still interested in, conceiving? Because that is very important to consider while choosing the treatment modality. I mentioned that there's some treatment that is just like you're cutting, you're not uprooting. So when you do that, there's always a tendency that these fibroids could come back. So there are treatment modalities. We have medical treatments that includes pain management, because that's one of the challenging symptoms. Pain management. We also have hormonal replacement therapies or hormonal therapies to help with estrogen and progesterone. We also That's more like birth control. And we also have iron supplements, because for women who have heavy bleeding during their periods and in between their cycles, they could lose so much blood that they become anemic. So that's also a management option. Iron supplements to replace the lost iron from bleeding or from menstrual blood. We also have surgical treatments as well, like we have a few of them. We have myomectomy. So for myomectomy, it's more like, cutting the fibroids, the tumor, but
Okay.
not harvesting it out, because probably this person is still in
Wanting
her
to have a
years
child
wanting to have. So we have different options of that. We have laparoscopy, we have hysteroscopy. We also have hysterectomy.
where the womb is
Yes,
completely removed.
where the womb is completely removed. We have total hysterectomy, where the organs, reproductive organs, are also removed. So they can do a hysterectomy and leave the ovaries. They can do a hysterectomy and take out the fallopian tubes, the ovaries, everything is out. And most times, after, for women that have already approached
Menopause.
menopause, or women who are not conceiving anymore. So we also have radio frequency ablation. This is more like using waves to how do I put it? To burn.
Yeah, to burn,
Yes,
because I
to
know about
burn.
thermal
Yes.
ablation when trying to stop
Yeah.
precancerous cervical cells.
So that's how that pattern is. They use that to burn the fibroid, the tumor, or the growth. So that is not also a complete treatment. So the best option is you discuss with your healthcare provider, see the options that are available, and know the right thing to do. However, there are also management modalities, what you can do to reduce your complications or reduce your symptoms or manage your symptoms, and that is diet. Diet is very important. The things we are all products of what we eat. 90% of the disease
Yeah, and now I'm
conditions,
remembering what I eat. I'm thinking about
yeah,
the product.
90% of the disease conditions that a lot of us are facing, or the world is facing, or people are facing, are caused by food. What we eat, cancer is food, diabetes is food, hypertension, all of these things. So if we can be very intentional about what we eat, it will really go a long way.
All right, so thank you so much for pointing out those treatment modalities. Oftentimes, when I interact with people, or maybe people are talking about, now this one usually comes with like the younger persons, because most times they will not want to go really for like the radical part of the treatment, like hysterectomy and the rest. Some people may opt not to go for surgery already. Some people have like a phobia for surgery and the rest. So sometimes people opt for medication. You've talked about maybe hormonal medications and the rest. But then the issue, and what people usually ask, is the issue of because most of these hormones work to shrink the virus, the fibroid, sorry. So is there a way you can ensure, because people have issues with fibroid, should I say regrowth, or if that's a regrowth, like after shrinking it comes back. So is there anything that can be done, or what happens in that point where fibroid shrinks and comes back?
Okay, there are some fibroids that actually shrinks. I should say degenerates. There are
Okay.
times that normally in our bodies we have times that we have hormonal surge. We have maybe in your 20s, in your 30s, you have hormonal surge and your estrogen at, high levels. There are times that you get to 40, it starts depleting, and that's when obviously the fibroids will shrink. There's also a time that you get still within that 40, you still have a surge in your hormones, estrogen, or when you get pregnant, even when the fibroid had shrunk, new ones could, still grow. And that's just it. Sometimes it shrinks, sometimes it comes back based on diet, hormonal factors, pregnancy, and all of that. But the thing is, if you have fibroids that are unproblematic, you have fibroids that do not present with any symptom. The women that have that, they don't even have, heavy flu. There's no pain, there's no abdominal distension, there's nothing. But they have fibroids. They don't have challenges conceiving. They have normal vaginal delivery, which most times fibroids, depending on the size and the location, causes complications during pregnancy, like placenta abruption or preterm labor, impeding the fetus from descending because of the position of the fibroids. These are some of the complications that comes with fibroids with pregnancy, and also high risk of cesarean section because of the position of the fibroids. So if all of these things I've mentioned, you do not have any problem, you do not have any symptom, but you have fibroids, as you approach menopause, the fibroids will
Shrink.
degenerate, it will shrink. Yes. Most women have that. Fibroid just shrinks, degenerates, because there are no more high levels of estrogens that they feed on or progesterone. So they're shrinking. That they don't have food to eat again. So most times, if you see that your fibroids are not problematic, I personally um, advise that women who have unproblematic fibroids should just allow it, as long as it is not posing a problem to their health, is not a challenge to fertility. They can allow it and just manage the symptoms that it presents with.
Okay, so like you've said, so because some of this, so how can people manage these symptoms, especially prior to treatment? Like you've said, maybe I cannot afford the treatment for now,
Okay.
or maybe I'm in a place that I cannot access the treatment for now. So, what are ways that people could possibly manage this symptom?
Okay, so the first one is the pain management. If you usually have pains, anti-inflammatory medications, over-the-counter pain meds. Also, we have green teas that have antioxidants and anti-inflammatory effects that are really helpful. They would help you manage inflammations, because obviously what causes these pains, what causes excessive bleeding is inflammation. Okay, so you incorporate this into your treatment modality or management routine. I've mentioned that. And also your diet. You should try as much as possible to reduce sugar. Sugar is also a culprit of that. Reduce sugar, especially if you are at, the extreme BMI. That's you are around 28, 30. Try as much as possible to watch your diet, reduce fatty foods, reduce processed foods, reduce canned foods, high carbohydrates, white bread, rice. Um,
Ah, our Christmas rice.
you can eat it on Christmas Day, but you should not eat it too much. Like, you should not eat rice from morning, afternoon, night. There are people that love rice that much. So if you are at high risk of having fibroids, or you already have fibroids, that's a culprit. That's something you should keep in check. Reduce that, manage your weight, and take iron supplements as much as you can, because you're losing blood. Literally, that is just it, until you can decide that you want to have the surgery done or not.
Okay, so as coming to you as somebody who coaches, a fibroid coach, and also a fibroid warrior, what do you think was like your greatest struggle, especially I want to say in the early days of when you realized that you were someone that was living with fibroid, especially during pregnancy? What was like the most? I know there are multifaceted struggles you might have faced. Which one was like the most obvious?
Want to know,
Yeah,
right?
yeah.
Okay, so that's had to do with pains, chronic pains, preterm labor pains. Yeah, I'm not even. I think okay. It actually started in my second trimester.
Okay.
Like the moment I hit second trimester, the wahala started.
No, that's like month 4.
Yes,
Okay.
that's month 4. The problem started, and it was a struggle from that time till the
Till
very day
the
I
till month 9. That's 5 months of.
exactly. I was hospitalized several times. And you know that rarely before you see women talking about fibroids. They say now only me gets fibroids. Rarely before you see women talking about fibroids, the pain that comes with it. And that is why, see, the people that message me, I've read like if you check my social media pages, you observe that these days I don't really post about fibroids because there's so much I have at hand, and attending to most of these things is. But the moment I drop a post about fibroid, I have an inbox. I have a message waiting for me. I have people that are not even in Nigeria. Recently, I had a client in, I think, Zambia also. She was in her second trimester, and she told me the experience she had. I was just smiling. I told her, "What did they tell you in the hospital?" I just wanted to see how different that side is from Nigeria.
Nigeria.
So she said they told her to, watch full waiting. She should just go home and wait
Wait.
for the
And wait.
worst. So unfortunately, she was already bleeding before she texted me that she wanted to sign up. She actually signed up for my coaching services, but she lost it. She lost it. So preterm, my worst struggle was preterm labor pain. But the luck I had was that there was no bleeding at all throughout that phase. There was no spotting at all. But when I say I was in pains, I was in mad pains.
Is that one our people say severe? Severe
This
pain.
is okay, you got that. So I was in pains. I was on bed rests the entire throughout the 9 months. I was advised to be on bed rests. So it's that bad because the location of my fibroids is actually the subserosal,
Okay.
and that means that it gets into the pelvic area. It affects where the baby is, how the baby grows, stops the baby from descending, or just is a challenge with the baby. The baby was actually trying to cope with, oh, how do I stay? Do I sleep here? Do I? So it was a challenge. The baby was a fighter as well and said, I promise you, I'm going to make it.
Okay.
So
So baby fighting a neighbor he did not want.
for real. So that was my worst challenge. And I told myself that if I'm out of this, I'm not going to keep my mouth shut. Because I know that there are a lot of women that are in this struggle as well. And I feel very terrible when I realize that there are a lot of there's just a little that can be done, or that's not that can be done. There's just a little that is done about women who are struggling with fibroids. Most times they just give you paracetamol. That pain is not a paracetamol pain. It's not a paracetamol pain. It's not something that you just say, go and endure, go and wait. So when you read my book on pain management, you realize that there are things that women can actually do to manage pains. Do you want me to spill everything
No, no,
here,
no.
Abby?
I don't want
I
you,
know I
but
can't
because
spill
no,
everything.
because
So we'll have
yeah,
clients.
yeah. So so because the next thing I was looking at, I was hoping because from someone who's experienced this, and I know you should also provide these services to your clients. Talking about because like you said, pain actually could be like a very physiological stuff, but then there is a psychological undertone to it. So what are as somebody who's lived it and seen it, and with what you provide to people, what do you think are the kind of support that people can give? I'm talking about I, as a man who is having a woman, whether as a sibling, as a wife, as a spouse, that, or anybody around, family, relative, neighbors, what kind of support can they give to such women?
It's very important. I usually tell women who are pregnant with fibroids that one of the blessings that they can have is a supportive partner, family member, Because most times, if you just want to rely on the partner, how about if the partner is unavailable, is not, unavoidably absent? The person needs as much love, care, support. Because if this person has to be on bed rest completely, there are, things that the person can no longer do. Maybe if the person is a housewife, there are chores that she can't do. So
Okay.
if you are the man, the responsibilities that you have to add to yours for that number of months, you have to be the one doing some, taking up some responsibilities. So she needs emotional support. It can be very draining. She needs a good therapy as well. She needs good support from the medical team. She needs a good medical team that is, very proactive, because these things will not even, they don't come announced. You could just be there very okay, and in the next, few minutes, you are in severe, it's like you're on labor. You have to be rushed to the hospital. So that you need a family or a support system that is handy, that is available for you, so that when you need to be conveyed to the hospital immediately, you have to be, without any delay. And you need a medical team that is proactive as well. It's not something that, you're rushed and they said, oh, please, the doctor is not on seat, oh, madam, no
Oh,
vex. No, no,
Nigerian
no.
hospital left the group chat. So for the dear listeners of the Intimate Matters podcast, that is why we bring you this information, because another thing that you could do to support somebody who is living with fibroid is to have the right knowledge and
Yeah.
information about it. Because I believe that people will show empathy and people will support what they understand and what
And
they know.
yeah.
Because most time we like, I'm in pain, like my people will see, do for do buy you made up. So you're not the first person that's ever been pregnant.
Yeah.
Generations of women before you have been pregnant,
Because
and
they
those,
don't
yeah, and those that
understand.
will be coming after will be pregnant. So that is why we want you to share this episode to the women out there, the men out there, people in leadership positions. Because I also feel that if the people in these positions actually understand what happened, who knows? Maybe they will make better policies.
Yeah, sure.
It's not an out of place thing to have like a fibroid clinic or a gynec clinic that is just dedicated to like issues that bother to women. So please share this video, share it to your friends, share it to that your family WhatsApp group, so that people can come and learn and understand more about fibroid, especially as it affects pregnancy. Because most times, sometimes you go on social media and you see things like, why is my wife like this? Is she the first person? How can she say that because she's pregnant, she cannot do anything? What kind of pain that my mother did not pass through and all of those stuff? And these are some of these things. There are certain things that may come with this pregnancy that maybe the women you've known before did not experience it. And it's just unique here. And that is why we give you this knowledge for you to actually know. So let's go to media, because you talked about being on the media. So,
Yeah.
what can social media do? Because we cannot exonerate social media. Social media has become, I don't want to say everything, but it has become almost everything for us
Yeah.
now. So, what can social media do in terms of helping when it comes to fibroid management?
Okay, so the first thing I want to really talk about is, I'm a nurse and I want to emphasize on the need for awareness creation, health coaching, preventive health management is very important. So I want to start with my colleagues. As much as you have knowledge about fibroids and other disease conditions, take it as your, responsibility to create awareness. So use your social media platform to create awareness, break some of these myths and misconceptions that, surround fibroids. I hear people say that, oh, sometimes it's the sin, people's sin that makes them. If you've not heard, that's very nasty misconception surrounding fibroids. And that is why some women decide to,
Just lock up.
just lock up and not say anything at all. So please let's use the social media to create awareness, to educate people. This is not the age that fibroids, or you have women in their 40s have fibroids. As long as a girl is up to reproductive age, let's say from 15, 14, as long as she's menstruating, she is at risk, she's vulnerable. she can have fibroids. So there's no age that is too young for you to, educate. And also, I wouldn't want to bring our celebrities in because obviously, that social media now, people, we listen, you know, we listen so much to our celebrities. We are their fans. So anything, sometimes we can even pie for them. We fight each other because of celebrities. So I feel like if there are celebrities that can actually come out, to talk about this, to create awareness, people will also listen to them. And for women who are struggling with fibroids and you've come out of it, you should be bold enough to share your story. You should be able to educate others. You should be able to tell how you pulled through. There could be somebody who is willing to listen. And lastly, the critics, the people who judge, the
Yeah,
people
because I wanted to come to
yes,
stigma.
the stigma is actually too much. Please calm down, relax, please. It's not that deep. It's not that deep, okay? There are people, there are women who have fibroids. So you may even go, people have some group chats. There are women that God, once they realize that a woman, maybe their girlfriend has fibroids, she told you this in confidence and maybe just to be sincere and open in the relationship, you don't they pack your load,
No,
they
I
run.
actually, unfortunately, I'm going to say this to my own shame to an extent. I know a senior friend of mine. A funny thing is that he's well later. That's why I feel bad because this is a man that walks within and beyond the shores of this
Okay.
country.
Be shocked though.
So God, I wouldn't say okay from what he told me, not like got married. So he's already started the marriage right with this lady, right?
Yeah.
And but then it's been a while. I think they've been together for like 2 years now.
Okay.
The pregnancy is not forthcoming. So one of these days, I was talking to her. I was like, before now, we're like, how is madam? She was like, oh, madam is fine. Very sweet stuff. But now, like, how is madam? We're like, okay, you know, go ask me and ask me. I'm like, okay. So what's going on? And then when, I settled down, we had to sit down to talk. So it was like, see, this is what happened. I saw some results, fibro, no doubt. And she was like, now, this brings me to what we used to start this conversation.
Yeah.
The lady has fibro, no doubt. So the medical professionals have advised on surgeries and whatever. And he said, no, that is spiritual. That in fact, before now, they didn't even know why he settled for the woman, that the woman used juju on him, that the church has said it, that this woman has spiritual husband, that there is nothing. And I tried to convince this man. The wife also is later, and the wife was like, we can even do, okay, if it's the issue with conception, we can do IVF. Right? The money is not the problem, at least today, what I know about him. But the idea of IVF was like, no! How can he marry and have a woman and she cannot give birth like everybody is giving birth and everything? And the last I heard from him, he told me I sent the woman packing.
So I'm not giving you people like gist, unrealistic gist.
I'm
Here.
serious. I tried to convince him, spoke to him, go to the hospital. He was like, he has gone to specialist hospital, he has gone to the teaching hospital. But that woman must leave his house. In fact, it was so bad that I wish he even sent the woman. He just gave the woman like silent treatment for months. Stayed off the house, didn't eat the food, and like. So please, I know he might watch this because he's an ardent follower. If you have not gone too far, sir, can you go back? Can you go back, sir, and bring madam back? Because that's why we do what we do, because most people don't have this knowledge.
Exactly.
So even when he showed me and I told him that it's fibroid, that this is what happens in fibroid, and I was like, no, that is spiritual. That is spiritual. And I told him that he told me the amount of money he has spent going around for cleansing or whatever he said it was called. I'm like, sir, you would have carried that money and they would have finished the surgery, or maybe they would have started the IVF procedure to a greater distance in the thousands, different places, different. So that was why I wanted to really come to the stigma. So thank you so much, first, for being willing to share your story.
Yeah.
And most people are not willing to share their story. My people say, God, if you are not my people, how will I explain this to you? So if you hide your sickness, you're going to die from that sickness.
Yeah.
It's as simple as that. So it's essential that you come out there. If you're a medical professional, put your knowledge out there. Nosima Oliver is there. Areni Maite on Facebook.
Yeah.
Yeah, and Nos Sinusho.
Yeah.
Yeah, CYNOSURA.
RE.
Yeah, that's our page on Facebook. So you go there and you need coaching as it pertains to fibroid. Awesome. Your book is on seller, right?
Yeah, it is.
Pain management.
With fibroids and diet modification during pregnancy with fibroids.
Fibroid. All right. So you go in and then you check out amazing things that you're going to learn. So before we let you go, Ma, I think you've hit on some of them, added to what I've said. What are like some of the misconceptions you think that people carry about this stuff that we should stop it? We should stop it immediately that person hears this very episode.
So the first one is what you said now. Once you hear that is a spiritual problem, you just say, "Ta, shut up," I lie. Nothing like that. I'm not, dismissing the fact that
Spiritual
things actually happen. But the energy you use in tackling the spiritual, you should also use it in tackling it medically. Okay, so fibroids are not spiritual babies. They are not from spiritual husbands. They're also it doesn't mean that if a woman has fibroids that she will not be able to conceive. It's very rare to see, fibroids causing infertility. It could bring challenges with fertility, but with proper management, medical management, there will always be, conception. So those are the few myths, like the serious ones. All other ones are, petty things. These are the ones that really concerns the the emotional well-being of a woman. So let's try as much as possible to create the awareness and dismiss what all those other small myths. Also, very important. It's not about 40 years, 30 years, or it's not about
It can happen to somebody in the 20s, can happen to somebody in the 40s.
several
Because
yeah.
there's all don't marry her, she's getting old, she has gotten to her late 30s.
No. So
okay, so thank you so much, I'm Nurse Imai Oliver, for joining us today.
You're
Thank you so
welcome.
much, you out there that is listening to us. I'm sure that you've already subscribed to our channel. Do well to like this video. And if you have any question, you want to share your story, please do well to share it in the comment section. Share this video to other people so that they can actually learn. Do not forget to follow RN Imaite on Facebook and also Nos Sinoshaw on Facebook. And I want to tell you that out there, if you have abnormalities, especially in your period, we're looking at severe chronic pains, we're looking at bleeding and having bleeding in between periods. So maybe your period used to come at every beginning of the month, but you're having bleeding in between. These are not normal things. These are things that you should actually go get themselves checked out, because we here really do care about your intimate matters, which has to do with your sexual and reproductive health. And that's why we're here on this podcast to take you on a deep dive into the world of sexual and reproductive health. And as always, today we're talking about fibroids, right? Trying to beat down the misconception, looking at what it entails, what happens, the kind of support that should actually be provided for people who are living with fibroid, and also how to actually manage it. Amazing books by our guest in the studio today as it pertains to pain management with pain management in fibroid, and also dietary management and modification in fibroid in pregnancy, especially for women who have fibroid and are also pregnant. She said something that is very particular. Fibroid doesn't always result in infertility. Yes, it could make it a little bit harder, but it's possible to have fibroid and still be able to get pregnant. So, sir, let it not be because of fibroid you decide to break up with that girl after everything she has been through with you. Please.
Oh, good.
It's something that can be managed. She wants you to love her and to support her. And you lady out there, please do not be ashamed of your story. Put your story out there. Seek help. If you've survived it, share your story. It's going to help someone else survive it. And until we come your way next time, I'm glad to be here sharing this with you. I am your anchor, Nurse Akwaowo Akpan, saying bye for now.